I'm Tal Geva, Chair of the Department of Cardiology at Boston Children's Hospital and the Alexander S. Nadas Professor of Pediatrics at Harvard Medical School.
My name is Rachel Wald. I'm the Vice Chair of the Scientific Statement. I'm a pediatric and adult congenital cardiologist in Toronto. I'm a professor at the University of Toronto, and I'm also the Research Director of the Toronto ACHG program.
An important part of caring for patients with repaired tetralogy of Fallot is to identify risk factors for adverse clinical outcomes. And the rising rates of premature death, life-threatening arrhythmias, heart failure symptoms, and exercise intolerance in this rapidly growing population have prompted numerous investigations aimed at identifying those at high risk for morbidity and mortality. Identifying risk factors for adverse clinical outcomes and developing and then validating risk factors algorithms are essential for data-driven clinical decision-making for timing of interventions such as PVR, ablation, defibrillator, or heart transplant.
So next, I'll take you through the highlights from 3 studies on risk stratification. The first comes from the Brompton, published in 2022 by Goniam et al. And it's a risk scoring system that they propose as a combination of clinical factors and imaging factors, including age greater than 50 years, sustained atrial arrhythmia, BNP level, aerobic capacity, ejection fraction, and late gadolinium enhancement. These factors can be combined to propose a risk score which can predict mortality. The second risk stratification approach comes from the indicator co-investigators published earlier this year by Mayurian et al. In this paper, there's a combination of clinical features, including age, obesity, type of surgical repair, and imaging features, specifically RV end-systolic volume index, and a biventricular global functional index, which can be combined to predict mortality. And finally, there's a paper from the CORRELATE registry published by Kovacs et al., which looks at factors associated with the superior clinical status based on patient-reported outcomes. This is a combination of demographic, clinical, and imaging features, specifically asymptomatic status, absence of a syndrome, having gainful employment, white ethnicity, and/or better systolic LV function.